This is where the sickest of the sick are going to be. If you come to the hospital and you are extremely ill, this is where you're going to come, is the ICU. We're split into 2 ICUs. We have a small surgical ICU. After they leave the OR, that's where we're going to get our traumas, we're going to get our heart patients, and then any other surgical patients that we get. And then our medical ICU is really going to be where our more chronically ill patients are. So you're going to have our acute respiratory failure, so your patients that are on the vent. We're going to get our post-cardiac arrests up here where we do target temperature management. This is where your strokes are going to come, and then we'll also take care of a wide variety of other patients. So it's kind of your acutely ill in surgical ICU, your surgeries, your traumas, and then your more chronically ill in medical ICU. Our ratio is 1 nurse to 2 patients, typically, which seems like a very light load when you're looking at how many patients a nurse takes care of, but there's a reason for that. The patients that are extremely ill, so they need very close monitoring. So in the ICU, we're looking at your vital signs at least once an hour. Frequently, we're looking at them more than once an hour. We're documenting those. You're going to be on drips that are controlling your blood pressure, your heart, your blood sugar. So we're going to be constantly titrating those, going up and down on those to keep you in the parameters. So they're spending a lot of time actually in the room, messing with medications. A lot of our patients are on the ventilator, so you're closely monitoring the labs that go along with that to see how they're oxygenating with a goal of getting them off the ventilator. So all of the care from head to toe that happens with our patients on our units, the nurse takes care of. We draw our labs, we give our bed baths, we bring the trays to the very large tasks of really monitoring everything that's going on with you medically, and then we partner with our physicians to get you better. I loved the teamwork in the ICU. You're never alone. The nurses work together. You don't admit a patient alone. You don't have a patient crash and you be alone. So they're very supportive. If I could choose one word that would describe the culture here, I would say family. Everybody says hello. Everybody's there to help you. Even though we're growing and we're becoming this very large hospital, it still feels very hometown to me. And I love that culture. I love that when I come to work, I feel like I'm working with family. I think it takes someone who is willing to work hard, and there's no task too big, no task too small. You have to be willing to work hard, and you have to care. The job that we do is hard. It's a difficult one, and there are decisions that families have to make that are difficult, but our job is to be there to support them. Our job is to compassionately give them information and be there for them when they make those decisions. So I think it's someone that has a good work ethic, but can also be compassionate and understand that every decision that's made in these units is literally life or death.